Let me.
Can you see it now, guys?
Nope.
What? Share screen.
Okay, now it's starting.
Really?
Yep.
All right, so you see it?
Yep. Click on from the beginning. Yeah.
Slideshow from the beginning.
Yep.
All right. Sorry for the kerfuffle, people. Welcome. And I'm really glad so many of you are here. And I don't know you all, but I'm really grateful that you're supporting our advocacy work. Now that we've got it, I am going to turn it over to Ray to take us through these slides. Right there.
Okay.
I'm not sure if Jennifer is here with us yet or not.
Yeah.
So we had hoped maybe Jennifer would present with, but I'm just going to go ahead and start. So
Okay.
where we are is we're in the introduction and welcome. And I'm Mary Kiger, the executive director, and obviously not the technical wizard of the crew. I know we have some folks from some supporting organizations, some of our associates and partners, and I'm really glad you're here. That's wonderful. We're grateful for that. We want to take you through, some of this will be familiar if you do a lot of advocacy, but what advocacy is and why you should be doing it. We want to talk about tips for legislative advocacy. We're going to tell you about what to expect at TCCN's Day on the Hill. And then we'll take questions and have a discussion. So in terms of who we are and what it is and what it means and why it matters, I probably don't have to mention this to you. You know that TCCN exists to support you who are in the field doing the hard work. There's no other reason for us to exist other than you. And when we go to visit the legislature or the governor or any other branch of government, we are representing you and only you. We never represent TCCN. Up until very recently, through these CDC grants to the Department of Health, we never had a penny to our name from any source. So we're not asking for money for ourselves. And it's important to note, when we go to Cordell Hall and we meet with our legislators, we're not really asking for money just for TCCN members, not just for your clinics or programs. We're asking for everybody in the safety net. We represent, when we do our Day on the Hill, everybody that is in the space with us. So that's FQs, that's some of the health departments, and we just take a really broad view of why we're there, and we're there to ask them for more money to support all of us who are working in this space, because our vision, I think, is so beautiful. It's charitable organizations working together to create a stronger and more compassionate healthcare safety net for all Tennesseans in need. And there's not a better example of that than when we get together and advocate for the safety net on our Day of the Hill. So, Ray, would you like to speak to this slide, or would you like me to keep going?
Whatever you want is fine.
Well, jump in and take some of these slides because you're really our expert. Ray is our chair of Public Policy Committee, and she has actual knowledge and background in working with legislature. I think nationally, that's her background. So let me let you speak.
Okay, great. Well, advocacy, there are really two aspects to advocacy. And one of them is lobbying. It's a type of advocacy. It's when we attempt to influence laws. 501c3s can lobby, but it can't be a substantial part of what you're doing. It can only be a small part of what you're doing. And sometimes you may have funding sources that restrict what you can do. So I'm assuming you all have some funding outside of your safety net funding That's the funding you'll be using when you go to the Day on the Hill, is the non-safety net grant funding. But advocacy can also be educating legislators about the need in your community, and that's a perfectly legitimate thing for you to talk about. It talks about, there's a real power in stories. Stories of your patients, stories of lives saved, stories of people who can go back to work because of the care you're able to provide. And those stories are what can motivate legislators to support funding for our programs or support other action that we might need to have. So a couple of years ago, we got a bill passed to allow volunteer healthcare providers to receive CME in exchange for part of their volunteer hours. So that's something that to provide an incentive and kind of a reward for volunteer physicians and others. So advocacy may not always necessarily be about funding. It could be about parameters for the program or things that help support the population we're serving. Okay, next slide. I don't think I can click.
I got you. I'm your clicker.
Yay. So there's a whole continuum of advocacy. It can include basic research and policy analysis, figuring out who are your legislators and how should you approach them. And that kind of work can include things like, do your legislators volunteer? Are they on a board that perhaps is familiar with or relates to your work? It could be community organizing or coalition building. It could even be direct lobbying or calls and letters. And it could be demonstrations or protests, or it could be litigation. I do a lot of work with the Tennessee Medical Association, and there are times that we've actually joined in lawsuits against insurers who were doing unfair practices that were really having an impact on access to care. And the part we really focus on as 501c3 nonprofits is really the education piece. That could include providing testimony or issue briefs, meeting with our legislators, and telling the stories about the work that we do. So all of those are different forms of advocacy, and most of them are perfectly legitimate for you as a 501c3 nonprofit organization. Okay, next one, Mary. At TCCN, we work on several different levels. So part of the question is who has the power and at what time in the process. So for instance, we've worked over several years with governors and commissioners to encourage them to continue to support and expand the safety net. Then we may look at what they're proposing in the budget and think, I think we need a little bit more money than that. So that's where we could go to the legislature and ask them for a supplemental appropriation, which we'll be doing now. And then the regulatory rule aspect really gets to the whole idea of all of the rules and regulations. When the legislature passes a law, it then goes into the regulatory process, and departments draft and enforce the rules that implement that law. So for instance, I mentioned that physicians, at least, and some other providers can get CME in exchange for their volunteer hours. That was passed a couple of years ago, but nothing had really happened. So I worked with a couple other folks, and we drafted some proposed rules for the Board of Medical Examiners to consider, and they eventually adopted that strategy. So now the rules are in place for that to happen. So this is just an example of the regulatory process at work as an advocacy lever. Okay, next one. So the most important thing when you're trying to advocate is to know your legislators. And I encourage you always to have a broad view. When we first started this work, people were thinking about who's the legislator who represents the area where my clinic's located. But really, you want to look at it more broadly to who are the legislators whose patients you serve. So probably most of you are serving, patients in several legislative districts. And so you want to look at that in terms of the service you're provided, not just where your clinic is located. And we can really build support by sharing some stories of the patients in those districts. So if you have examples and the patients are comfortable, even de-identified with you sharing their story, that's a really good idea. Okay, next one, Mary. I'm suffering today from Chattanooga's pollen. pollen.
You're good. Keep going. You got it.
So anyway, so do understand your legislators. It's helpful to know what kinds of issues. It's important to look and see what committees they serve on. So for our purposes, the House and Senate Health Committees are important, and the House and Senate Finance, Ways and Means Committees are important because that's where the money comes from. Think about any hot topics, and the most important thing is to prepare your pitch to be 5 minutes or less. Especially if you have somebody going to see a legislator and you have a past relationship. I remember taking a group of doctors one day to see a legislator, and one of the doctors had gone fishing several times with this particular legislator, and they started launching into fish stories, and pretty much could have used all of our time together had I not said, "That is so interesting. We'd love to hear more about that later. Today, we're here to talk to you about X." So try to keep them on topic because you probably won't have very much time with legislators. This is the second year of a 2-year legislative session. So they really want to adjourn by the middle of April so they can go home and campaign. Legislators cannot fundraise for re-election when the legislature is in session. So there's a real imperative for them to get stuff done this year. So time is of the essence. During your visit, ask if they're familiar with your organization. Share the stories that you can. And ultimately, legislators work for us. We elect them and they expect us to have some requests. Will they always embrace your request? Not always, but it's still okay for you to ask because you're trying to represent and serve people that they were elected to represent. After you do your legislative visit, be sure to send a thank you note or email, invite them to your clinic, and then complete any follow-up items. That's really important. A lot of times a legislator will say, I'd like some more information about X, Y, or Z. And I just keep little cards in my pocket so I can make a quick note. And the first thing I do back at the office is do the follow-up in the thank you and respond to whatever additional requests they have. You can also invite legislators if they have constituents who need support. Invite them to make referrals to you. Legislators get calls about all kinds of things. And periodically, Mary or some of our partners will, get requests from a legislator because they've heard from a constituent who's having a problem. So that's a really great way for us to demonstrate our value. If you've got a board member who'll come or a patient, it's always great to bring them along. Legislators generally do really appreciate the hard work that you're doing. I said earlier, patient stories, invite them to come visit your clinic, offer to help constituents, and don't forget to bring a name tag and business cards. So those are just a few quick pointers. When we go on the Day on the Hill, we want to thank legislators for their past and current support of the safety net, and we'll have specific language as we need to ask them to support our request for supplemental appropriation. This year, the budget, the basic budget request is $21.9 million from the health department. We do not know, but I don't think the governor's requesting any additional funding. So last year's funding was $24.9 million. So we want to, at a minimum, retain last year's funding level. So we're going to be requesting a $5 million supplemental appropriation. That's something that the legislature does, and that happens through the House and Senate Finance Committees. Representative Speaker Lamberth has once again agreed to carry our $5 million request in the House, and an ask is out to a senator, and we expect to hear back hopefully by next week. The governor has also included in his budget some additional funding for a dental TennCare benefit and for a dental services pilot program. So I think we will be adding a second ask just to encourage legislators to support those programs. And Rhonda's on the call and can give us a few more details. This is our fact sheet as it exists at the moment. We have a couple little tweaks we're still making on it, but this is our basic fact sheet. Page 1 demonstrates the funding history over the last few years. And so that will, kind of in a nutshell, make our case to legislators. The yellow Post-it note on the front page is a summary of all the care provided through the safety net, and that includes our community and faith-based programs, the federally qualified health centers, dental providers, project access. So a broader range of partners is included in that number on page 1. The whole point of this fact sheet is to easily convey our need for funding for these programs. Page 2's comes in and hones in a little bit more specifically to the community and faith-based programs and project access initiatives. So that's that information on page 2 is specifically about those that TCCN serves. On the little bar chart you see about TCCN members by service area, that breaks out our urban and rural areas. But I do want to make the note that many of the members in urban areas actually also serve patients in the surrounding rural areas. Project access programs are now expanding more broadly, and over time we'll be serving more folks. So, hats off to Mary and to Renee, who've been working feverishly to get our updated fact sheet done. So we'll have the final copy of this. We'll email it to you in advance, and we'll have a stack full of copies for you to take to your visitors and legislators. You may want to bring brochures about your programs to localize it for each legislator, but we'll have a lot of copies in color of the fact sheet available for you next week. Mary, do you have other details about what's happening on the Day on the Hill before we go to questions?
Yeah, sure. And let me just mention on this big old hairy looking map, the reason we want that in there, and this is something that Ray usually stresses, so I'm jumping in and saying something she usually says, which is, legislators like to look and see their district, and they like to kind of go, oh yeah, these are all the people that are being supported by this money. These are the programs that are being supported. So again, even though it helps us, it helps everybody because we're all in one boat. So it's great to be able to show our own community and faith-based primary care, but, we are very grateful for everybody on this map, and that's who the funding is for. So you can think about, just in a nutshell, page 1 is really about our ask and about the safety net, and then page 2 is a little more about the important work of TCCN members. So what to expect? It's going to be a really fun day. I'm very excited about it. I mean, I hope it's a fun day. I shouldn't say that because that's low expectations are the way to go. If you could get there about 8:20, because you're going to have to be scanned, and that takes a little minute. And if you're going to Cordell Hall, I know Renee had sent all this information before. We can resend it about where Cordell Hall is, where the conference room that we're going to meet in is. Parking, the cheapest parking is the library, and you hoof it to the Cordell Hall building. It's a few short blocks. It's not bad. But if you want closer parking above the bus station is a lot of parking. It's a little more pricey. So we're going to meet in 5C at 8:30, and we'll have breakfast and fact sheets. We'll be handing those out. We'll go through talking points again. And apparently, the Commissioner of Health would like to join us for breakfast, which is just phenomenal. That has never happened. We thank Rhonda. I'm pointing at you, Rhonda. You can't see. Who's been working closely with the Commissioner for making that happen. Yay, 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 yay. That's so exciting.
Mary, Dr. Wink would like to introduce her when she arrives.
So he will introduce her. Dr. Wink, of course, is the CEO for Delta Dental. We're going to give Rhonda just a few minutes at the end to talk a little bit more about this exciting work that's happening in dental. But that is really the reason that they are coming. So please try to be there to welcome them. You'll have your individual appointments, but if you can, we have, I think, did Representative Patsy Hazelwood confirm yet? We will have it confirmed shortly.
Yeah, no, she, let me look at my email. I haven't looked for a little while. Then
We'll let you know, surely, maybe before we get there, but surely the day of, we'll let you know if at 11 we can go into the House, it's the House
finance.
And we'll go there and be recognized, TCCN. They recognize a lot of people. So, here's my nephew from wherever, and, the Boy Scouts, but here's TCCN, and we jump up and woohoo, and everybody claps for us, and it's fun. So, and then we'll have lunch at 11:30 back in 5C. And at 1 o'clock, again confirming, Senator Bo Watson, who is the chair of the Senate Finance Committee, will introduce us from the floor, and we'll have the room numbers and all the particulars of that the day of. So we might have a chance to be introduced twice, which would be new for me. That's really cool. Also, either myself or Ray will be available to you to attend your meetings with your legislators. If you don't want to go by yourself, you just don't feel confident about it, it's not a problem. And anything else that you need, we're here for you because you serve those in need. So thank you. So do we want to give Rhonda a minute to speak on the kind of dental action that's happening and then go into questions and answers?
Yes, I think that would be lovely.
Okay.
Thank you. And can I share my screen?
Please do. Let me unshare. Let's see. I think we have to give you permission, security. I'm enabled. Share screen. I'm letting you do it.
I gave her access.
Yay.
You should be able to share.
Okay. It says host disabled participant screen sharing.
Well, doesn't that just figure?
Try again
Ray,
now.
did you want to bring it up? I sent it to you.
Well, hang on. She says try again.
Try again, Ray, Rhonda, please.
Oh, there we are.
Yay.
Can you see that?
Yes.
Yes. Okay. So this is an attempt to share what's all going on with dental. All of the items are solidified onto one page. So the 3 teeth, one is the TennCare benefit, and that is in the governor's budget. And it will give, right now, there are 650,000 adults on TennCare, and 50,000 of them currently have dental coverage, 40,000 pregnant women approximately, and 10,000 intellectually disabled persons. And this will give the remaining 600,000 a dental benefit. Now, it has been estimated that there are 1.2 million uninsured in Tennessee. The number of dentally uninsured is greater than that because, I mean, that's the number of medically uninsured, but some people get medical with their employer, but not dental. So we know the need is great. So the second item is the dental services pilot program. And that includes money for the dental schools to increase their class size, eventually put more of them out in the community into our clinics, if we like that idea, provide some loan repayment to encourage dentists to go to rural areas to practice, but also to practice at health departments and FQs and safety net clinics like ours. It also has money to increase the size of the Smile 180 Foundation's denture fund, and it has money for Smile On 65 plus. Yay! Now the key thing with this is the original proposal was 94 million. This is year one, and that's what's in the governor's budget. So it is budgeted, but of course we'd like to say, you know, we need all 5 years of this pilot to make real advancements. The third item is the safety net dollars. And if you recall in previous conversations, when I was in the governor's work group, I brought up that there are a lot of new dental providers within the safety net, and the amount of dollars for a dental encounter is not sustainable for all of us, and that it needs to be more in there for dental. So this addresses that issue, because when I brought it up with the committee, they said, well, we've already made the safety net budget bigger, so we don't want to talk about it. But Commissioner Piercy and Dr. Wink feel strongly that there should be even more money in the safety net, and that a lot of it, more of it should go towards dental specifically. So this is where an additional appropriation on top of the 5 million to make the amount whole would come in. And this, of course, is for those we all know in the safety net, the age 19 to 64, that are not going to be on TennCare and are uninsured, and the bulk of who we see at our charitable care clinics. And then in the bottom, the little illustration just shows who it is all this funding is helping. And I put the logo of the Alliance of Oral Health Advocates on here, and that is many of you, and of course, lots of the FQHCs and the dental schools, etc. But if you all like this fact sheet and want to use it, I can also put TCCN on this. Or if you just want TCCN on it, whatever the group feels like, I can bring copies for you so you have this. Now, there's other information on the back of the sheet that goes into the detail of what all those things exactly are. Okay. Any questions?
Feel free to unmute, turn on your cameras, get interactive. And you can ask questions about anything you want at this point.
I think it would be great to add TCCN's logo in that flyer that Rhonda just shared. So it is also evident that we support the initiative, and because we're all in this together.
Yeah, I think all of us would agree with that. So unmute yourself and holler if you don't agree. Otherwise, we'll consider you agreeing. Complete agreement. I love that.
I agree. Can I ask a question? And you might have covered it when I bumped out and had to bump back in. Can you send all of this to us before we come?
Yes, I will
because I'd like
send
to.
Yeah.
I'd like to read over it, even though I feel like y'all have done a great job covering it either today or previously. But I'd just like to be able to say, "Oh, yeah, it's right here." You know.
Absolutely.
So.
Yeah,
We're still making. We're making just a few little tweaks on it, but our goal is to clearly get it out no later than Monday for everybody to review, and maybe even tomorrow.
Right.
Could
And then
happen.
the two sheets and this presentation, if this is helpful in terms of reminders. Other questions? I know some of you haven't been and are planning to go for the first time.
Yeah, that's me. I have a question. Or several questions.
Good.
So, okay, you said, so of course you're going to have your meetings set up with your representatives. And I'm like, well, do I do that? Do I need to email them prior and get those set up? And where do they happen? And how long are they? And all that.
Sure.
Yes, you need to email them. It's easier probably to call and talk to their assistant, and email them. You can do both. You know, they generally are running late. It's tough. You know, they're running, or and you get maybe 15 minutes. And so it's really important to kind of just jump in and go to the points you want to make. And again, Ray or I would be happy to go with you. And you do want to think about everybody, all your patients, where they come from, and try to make appointments with as many of them as possible. And if you
Okay.
need with scheduling, I'll help you. But it's really, generally they're expecting this. We're not the only ones that have a hill on the day. Every free and charitable organization in Tennessee has a hill day. And so they're really used to constituents saying, hey, this is our hill day, we're coming, when can I grab Senator so-and-so, Representative so-and-so? Just want to introduce myself and talk for 5 or 10 minutes, and they'll say, oh yeah, he'd love to meet you, or she'd love to meet you. I mean, people who have been there before, am I telling it truthfully?
Yeah, just, and I would, if you are sure your legislators know what your program is, I would send an email and then immediately follow up with a phone call. Do both, so they have just a little bit of information about your program, and they know. And I would go ahead and send that out today, being it's Thursday. Legislators are normally on the Hill Monday. They come in Monday afternoon. They're there Tuesday, Wednesday, part of Thursday. Most of them try to go back. Committee meetings are running a little longer because they really are kind of on a crash course to get done by April 16th. So go ahead and set up your meetings. And the House Finance Committee is at 11, and the Senate Finance Committee is at 1. And those are we're just trying to get an introduction. It's helpful for legislators to see all of our shining faces. It just reinforces that there are a whole bunch of us advocating for these programs.
So, like I have two legislators that like in our district, we serve 2 districts. And so I just need to get those 2 appointments set up, like after breakfast before the 11 o'clock thing. And I'm just, that's arranged with the assistant as to where they'll be.
Yes.
Okay.
Yeah. You'll meet in their office. Occasionally they'll tell you to come to a conference room if they have several requests, but usually you'll just meet in their offices. And all the legislative offices are now in one building. It used to be in 2 buildings. It was very hard to navigate if you weren't used to it, but it's all in one building now. So it's much easier.
There was I was going to say, Kelly, and to everybody, you know, the most important thing is meeting with your legislators. So, you know, and we'll have breakfast and lunch for I think it's an hour and a half each time. So, you know, feel free to schedule into that time, or even when we're being introduced possibly, because really that one-on-one contact is wonderful.
Mm-hmm.
So don't feel like you have to get it within a certain timeline. Their timeline's the one you want to go with.
Okay.
Also, Rural Health Association of Tennessee is having their Hill Day at the same time. So you might see some friends in the halls, which is fun. It's interesting, the legislators back in the old days, they used to have to be in the same halls that all of us were in, everybody trying to get their time and attention. Now in Cordell Hall, they have their own elevators. So it's very rare that you run into any of them. I mean, you know, they kind of have a Disney system, you know. So that's why we need the appointments. We can't just snag them anymore. Other questions?
Question. Should you bring them a gift?
What kind of gift?
Well, I was pondering a ticket to our event. That's at the end of April.
What's the monetary value of that?
$40.
We have our legislative person here with us. We are hiring Elisa LaPointe, who is a lobbyist in her previous life. And she would know that answer. Do you have a problem with that, Ray?
I think that value of that is less that, well, yeah, yes, I do.
Okay,
The legislators are limited during session to the dollar amount that they can take, and it can, and I haven't looked at the, to see what the dollar amount is right now. But I would tell them that you're going to be so excited to send them. Now you could take them a coffee mug or a little bag of chocolates, or, you know, a cookie, something that's got negligible financial value. And then I would tell them you're going to be following up, and you'd love for them to be your guest, because by the end of April, the session will be over. So yeah, I would, and I'll look online and see what the dollar cap amounts are right now.
But it
We
would
always
not-
have our legislative dinner before session starts every year, because also the other thing is, if there's a dollar amount value of something, it can also impact their per diem, and we don't want to do that.
Got it. But you said a little chocolate thing. I mean, I've got like a little pill container that has partners on it. I could put that in a little piece of chocolate, and an invitation to the event would be fine.
sounds nice. Bring me one. Other questions? Okay, well, we're going to be there to support you in any way you need. If you come up with other questions, just let us know. 2 years ago, Ray was in Nashville, as were many of our wonderful board members, and we had the tornadoes, and her hotel was damaged, her car was totaled, as I recall, and it was a bad experience for everybody. So I get a little anxious in early March. So far, so good. We haven't had any major weather events. So prayers for, you know, just a beautiful week when we do our day on the hill would be great.
Thank you for reminding me, Mary. I tried to block it out. Yeah, hotel took a direct hit from the tornado. It was really magical.
Well, if there are no more questions for anybody, we will follow up. And of course, we're here by phone, and we'll be there in person. And so pleased that all of you are interested and willing to show up and be the great people you are. Really.
It's fun.
Kelly, if me or Holly could go with you as well, if that's helpful.
Hey,
We're both going to be there. So, and if you need any help making that call, Holly can help you too.
Oh, that's
wanted to
Thank
offer
you.
that.
I appreciate it.
Yeah.
I'll be enlisting.
It was my first time one time too.
I do have my president emeritus is coming as well, but she's never been either. In fact, I'm going to have to brief her on what it's all about. So yeah, definitely having someone there would be helpful.
great. That's it.
I had one quick question.
Sure.
What time will everything be wrapping up?
Really, after that 1 o'clock introduction, if we get it, and if you don't have people that you're meeting with, you know, after the introduction or after lunch, some people get their appointments a little later. I know, you know, some people can't get an appointment till 1:30 or 2. I'll be around until all the appointments are completed. But you're free after you've done your appointments and had as much fun as you can stand to go on home.
All right, thank you.
Sure. Look forward to meeting you.
Absolutely.
And Mike, can you introduce yourself to the group, because you're with a partner of ours and they may not be familiar with you.
Yeah, sure. My name is Mike Arnold. I serve as the program director for Christian Community Health Fellowship. And so we are a national organization that we work with free and charitable clinics all across the nation, and also locally at the state level as well. And so I'm looking forward to developing relationships with you all at the state level.
We'll look forward to that very much. And Natasha, if you're available to unmute and introduce yourself, that'd be lovely. And if you're not, no pressure. That sometimes works, sometimes doesn't.
Oh, it's definitely pressure. Good morning. How are you? I am Natasha Yokley, and I am from Meharry Medical College of Family and Community Medicine with the Tennessee AHEC program.
Beautiful, beautiful. So glad that you could join us.
Thank you.
Okay, everybody can have approximately 10 minutes back into their lives if we're done. Thank you all.
Thank you.
Bye-bye.